Good evening, everyone. You're welcome to NASoW 2020 conference, the first of its kind. My name is Fagbero Olamide, the program officer, NASoW Lagos chapter, and your host for this program, this 3 days virtual program conference. We really appreciate you all for joining in. We have our programs as listed, and I hope we are all going to benefit from these programs as we go on. Thank you very much for joining in. We hope to have a successful deliberation. Thank you, and you're welcome.
Oh God of creation, direct our noble cause, guide our lead us right, help our youth the truth to know. In love and honesty to grow and live in just and truth. Great lofty heights attain to build a nation where peace and justice shall reign. Arise, O compatriot, Nigeria, call away to serve our fatherland with love and strength and faith. The labor of our heroes shall never be in vain. To serve with heart and mind, one nation found in freedom, peace and unity, peace and unity.
So on the agenda, we have the opening remarks by our chairperson, NASoW Lagos State, in the person of Ogedengbe.
Good evening, everyone. You are welcome to the 36th Annual Conference of the Association of Social Workers, taking place virtually. This is the new normal, we all know that. Normally, at this time of the year, we gather somewhere in one of the states to celebrate our annual conference. But this year, we are having it online. Thanks to the pandemic, we welcome you and we hope you have a good time deliberating and looking and charting a new course for social work in Nigeria. Once again, I say you're all welcome. I'm Adeto Obedengbe, the chairperson for Lagos State chapter of our Noble Association. Mr. M.E. Mustafa is the national president of Nigeria Association of Social Workers, and he's going to give us the opening speech. He's going to declare this conference open officially by his speech. You are welcome, Mr. President.
Honorable colleagues, I welcome you all to this annual conference. Please permit me to recognize the presence of the President of IFSW Africa, Mr. Noel Morizo, and his vice, Mr. Joaquin Mumba. It's a great pleasure to have them with us. I hope we are all coping with the challenges of COVID-19. By the grace of God, we shall overcome. There is God's promise on this. The Lagos State chapter of the Nigeria Association of Social Workers has shifted its 2020 hosting right for the annual conference and general meeting to 2021 for physical meeting as a result of the pandemic. The virtual conference is put in place in order not to create a total vacuum. We are grateful to the Lagos State chapter of NASoW under the leadership of Mrs. Tongo Gidimbi for dominating the pandemic circumstances. We appreciate the chapter for displaying maximum courage. The current National Executive Council of the Nigeria Association of Social Workers came on board on 16th of November 2018 with 3-point agenda. One is the actualization of the bill of professionalization. Second, the reclamation of the social development ministry as social development as an independent ministries from the Ministry of Women Affairs to create professionalism. Stressing of NASoW to prevent exploitation. I want to assure you that we have not defected from the agenda. The Nigeria Council for Social Work Bill is on course, and it has been returned to the National Assembly in March 2019 after the corrections were made and perfected as directed by the President of the Federal Republic of Nigeria, General Mohamed Buhari, at the instance of observations raised by the Ministry of Women Affairs, then our parent ministry. The corrections were done by all major stakeholders: Ministry of Justice, Youth, Social Welfare, Women Affairs, and the Nigeria Association of Social Workers. With the assistance, through the assistance of the United Nations Children's Fund, UNICEF, NASoW is very grateful to this international organization for always being there for us. On the 6th of February 2020, the bill was read on the floor of the National Assembly after the initial hiccups. We were expecting the passage before now, but the pandemic came at a very wrong time. I thank the media, the Nigeria Association of Social Students, and others who stood by us during our period of trial. On the reclamation of the social development from the Ministry of Women Affairs, we have sincerely achieved this. Our social development is now under Ministry of Humanitarian Affairs. It is a professional ministry that is responsible for poverty alleviation and cash transfer. The ministry is huge and large, with 6 strong agencies: the National Commission for Refugees, Migrants, and Internally Displaced Persons, 1; National Emergency Management Agency, NEMA; East Development Commission; Office of the Senior Special Assistant to the President on Sustainable Development Goal; National Agency for the Prohibition of Trafficking of Human Persons. These are the 6 agencies under our new ministries. We have met the Honorable Minister and put before her the Charter of Social Work Practice in Nigeria. In our efforts to strengthen NASoW, we have successfully resuscitated and rejuvenated some of the state chapters. Among them are Osun, Akwa Ibom, and Niger states. We have also succeeded in opening up the chapters in the Northeast region, which were dormant as a result of insurgency. Nigeria Association of Social Workers, after years of existence and years of selfless service to humanity, has now become a milestone from which to take a stock. Reappraise our ideas and objectives, evaluate our objectives, recount again the odds we have encountered, and pray for more peace and more progress. I thank you all for your resilience in keeping hope alive. This meeting is very unique because there is nothing better than sharing experiences. Long live NASoW, long live the Federal Republic of Nigeria. Thanks and God bless.
Thank you, National President, Mr. Mustafa Moshood. We are grateful for that wonderful speech. Next on the agenda, I would like to have the goodwill message by Mr. Noel Mudrizo, that's International Federation of Social Work, Africa Region, Africa Regional President. You're welcome on board, sir.
Thank you so much. The President for the Nigeria Association of Social Workers, Mr. Mustafa Mashud. The Chairperson, Nigeria Association of Social Workers, Lagos State. The President, Nigeria Association of Social Work Students. Invited dignitaries and speakers, or may I simply say, all protocol observed. It is indeed a great honor and privilege to deliver a message of goodwill on behalf of Dr. Noel Murizo, President of the IFSW Africa Region, before this August House. This national conference is one of a rare opportunity for mobilizing social workers, as well as giving an assurance to members of Nigeria Association of Social Workers on the need to belong to the professional body. I note that social workers in Tanzania are also having a similar event, which is part of their tradition as they normally hold annual conferences. Conferences such as this one help to create a platform for sharing best practices, as well as enhance building of solidarity among social workers. The theme, social work practice during critical periods, challenges and their prospects, would not have come at the right time as this, when the whole world is at war with COVID-19 pandemic. It is indeed a time when we need to reflect on the relevance of our profession to emerging issues and social problems. It is a time when we need to interrogate our social work practice approaches versus our societal mandate as social workers. These are indeed critical times as the pandemic has worsened the already vulnerable conditions of those who receive social work services, apart from generating new groups of vulnerable people. Critical times as they may be, the pandemic has also raised a sense of self-awareness among social workers, as a number of practitioners across Africa have been able to demonstrate the relevance of social work in society. As a profession, we have for a long time suffered the tag of being invisible and the workforce being regarded as non-essential. But thanks to COVID-19, most governments in Africa have come to appreciate the important role that social workers can play in such situations. On behalf of IFSW Global and indeed the Africa region, I wish you all the best and fruitful conference. IFSW is excited to be part of this great event, and more so that you have embraced social work students as we prepare them to carry forward the baton from us as leaders of this great profession. God bless you all, and God bless the great nation of Nigeria. Thank you so much.
Very much, Mr. Joachim. Thank you very much, Mr. Joachim. We appreciate your wonderful speech. Next on
Thank
the
you.
agenda, and next on the agenda, we'll be having the National Nigerian Association of Social Work Students, NASoW President Obiagwe, for his goodwill message. Mr. Obiagwe, are you there?
I don't think he's online. I don't think he's
Yes,
online.
he's having issues with his connection. I chatted with him a while ago.
Okay.
Whenever we have him, we'll make him go ahead with the goodwill message. Can we go ahead with the next agenda, please? The next item on the agenda, please.
Okay, the next agenda now is the introduction of the speaker. Okay. Our speaker today, our first speaker for this wonderful virtual conference, the first of its kind in our dear country. Without wasting our time, I would like to bring on her the guest speaker for today. She is a social worker of note, a senior lecturer, and global instructor. She is a mother, a lecturer from the University of Jos. From University of Jos, she's an indigene of Plateau State, Nigeria. She holds a BSc Sociology degree from Ahmadu Bello University, Zaria, 1993. She holds master degree in Sociology, 1999, and masters in Social Work in the year 2007. A PhD in Sociology in the year 2016, all from the same University of Jos. She is currently employed with the University of Jos. She has been a level coordinator to sociology undergraduate students. She was the coordinator of the BSc Social Work program from year 2012 to 2017. She has been the faculty representative to various faculties. She is a senior lecturer and current head of sociology department and Department of Social Work and Administration. She has researched and written over 20 published works to her credit. Her areas of core interest are gender and women studies. Her core interest in social work is on gerontology and geriatric social work. She has taught both undergraduate and postgraduate students and currently supervised over 15 masters and 2 PhD ongoing. She is an external examiner to Social Work Department, Federal University, Lafayette, Nasarawa State. She was the secretary of the Gender Intervention team of the Jos Carnegie Partnership Program from the year 2006 to 2012. She was a member of the African University Gender Resource Network, year 2006 to 2012. She is a trained master trainer for UNICEF. She has many awards, mainly by students, for model lines and for being the first female HOD. She has traveled to other countries like Ethiopia, Kenya, Ghana, Manchester, New York, and Canada. Her hobbies are cooking and watching movies. She is a member of the National Association of Social Work Educators, NASW, National, and also National Association of Social Workers of Nigeria, NASoW. So I have the pleasure of bringing on her Dr. Janet Plang. Dr. Janet Plang, you're welcome to our 2020 virtual conference. We're happy to have you on board.
Um, Good evening, everybody. I'm glad to be here. I first of all want to thank the National Association of Social Workers in Nigeria I recognize the presence of the African continent representative and all other EXCO who are here. It's a great pleasure having to participate in this national conference, the first of its kind for the Lagos chapter. I want to thank you all also for finding me worthy to participate in this. And with that, I would love to carry on with my presentation. During pandemics, a social work perspective. Now, what are pandemics? Various countries and nations world over have had various experiences of outbreaks of diseases or environmental disasters that have been described as epidemics or pandemics. A pandemic is defined as an epidemic occurring worldwide or over a very wide area, crossing international boundaries and usually affecting a large number of people. This is the definition by World Health Organization. What's the difference between an outbreak, an epidemic, and a pandemic? An outbreak is when an illness happens in unexpected high numbers. It may stay in one area. It may stay in one area or extend more widely and can last days or years. Sometimes a single dose of a contagious disease is considered an outbreak, especially for an unknown disease to a community. An epidemic is when an infectious disease spreads quickly and affects more people at the same time. It usually affects a larger area than an outbreak. A pandemic is a disease outbreak that spreads across countries or continents. It affects more people and takes more lives than an epidemic. And the World Health Organization declared COVID-19 to be a pandemic when it became very clear that the illness was severe and it was spreading quickly over a wide area. Now, while a pandemic may be characterized as a type of epidemic, an epidemic is not necessarily a type of pandemic. Next slide. Now, we need to understand the particular group of people we're talking about here. So let's have an understanding on the aged. Effective care on the aged is based on quality knowledge and interaction about them. This is dependent on certain variables of the aged, which include age, sex, level of enlightenment, education, religious affiliation, family life, employment, history, and health status, amongst others. Aging is a long and sometimes complicated process which involves process in life. Basically, there are three types of aging. You have the primary aging, the secondary aging, and the tertiary aging. Now, the primary aging happens to all of us. The secondary aging happens to most people. And the tertiary aging is a heralding way of aging, which is basically how life ends. In the primary aging, it has certain features that you observe about what happens to the aged there. There's a physical attributes and those that are not physical. And then under the secondary, you have certain factors that are responsible for the secondary aging. And basically three among these are the ones responsible for secondary aging. You have disuse of the system, body system. You have abuse of the body system, where sometimes we take alcohol or cigarette smoking, things that are harmful to the system. And then we have disease, which is what we're talking about today, like the COVID thing. These three factors actually are what culminate into the secondary aging. And an aging person begins to see himself aging even when it is not yet time, because of these three factors I have given. Now, universally, the chronological age definition for the aged is 65 years. Now, this is aside the functional age capacity, which vary and cannot be relied upon for social policies of the aged. Now, In many countries, the chronological age differ, but they all tilt towards 65 years. In some countries, you might find 58, 59, 60, right through to 65. And in some countries, the issue of sex is an issue. The chronological age for men is sometimes different from the chronological age for women. And so it varies according to country. Now, for you to understand the aged, we must appreciate the kinds of problems and challenges that they face generally. And below, I have listed some of these problems and challenges. Poverty. Poverty for me is quite critical. It's one of the great challenges that the aged face today. And this is as a result of economic conditions very apparent in the economic system of a country, or even on individual attributes that have led to people being poor. And poverty is something that's seen very critical among the aged. Sometimes not even a fault of theirs, but this is what happens to them. And because of this, they find themselves in a very sorry state, so to put it. Neglect and isolation is also another problem faced by the aged. Sometimes people feel that the aged have lived their lives, and so there's no care towards them. And sometimes they are neglected in such horrible conditions, sometimes totally isolated and forgotten about. Discrimination is also another challenge that they face. They feel that they are no longer, sometimes people feel that the aged are no longer useful in the society, and therefore they discriminate against them, some simply probably because of their vulnerable nature. Poor housing has been noted as one of the challenges that the aged sometimes you notice that now we do not have comfortable housing to stay, it becomes a problem. You're not balanced. Now, and it's unfortunate, but we thank God that the Nigerian government has taken up the housing scheme thing. And so many civil servants are beginning to enjoy that. But hitherto, before this time, this wasn't the case. And so people could not afford proper housing for themselves. And that has been a problem. Then you have, of course, chronic diseases. I had already discussed and told you that diseases are part of the aging process. You have the likes of diseases like diabetes, high blood pressure, cancer. These are very common diseases that usually affect the elderly. Then, of course, another problem that they have that is general, and it's quite something that we know happens, but many a times people like to hide it, and that is elderly abuse. Many of the elderly especially by their caregivers and to an extent sometimes by their relations, and this is quite unfortunate. Elderly have poor welfare services, especially in developing countries like Nigeria, where we don't have good plans and policies regarding welfare of the aged. This really affects their welfare. And we do not have institutions and things that will handle their welfare services. Take, for example, the developed countries. Would agree with me that they have discount in stores where they go to buy things. They have discount in terms of developed countries. Are proportionately affected as a result of this. Next slide. COVID-19 has had its effect on all members of the society. Look at some of the effects it has had on the aged. The World Health Organization.
Hello, can you hear me now?
Yes, we can hear you now. We can hear you loud and clear.
Okay. I was apologizing for not challenges connecting up with the network. But
Okay, we
yeah, I
can
can
hear
hear
you.
you. So I was saying my apologies for not keeping up with time. I had a few challenges meeting up with a whole lot of things, but hopefully I am back on track now. I must say the theme for this conference is indeed an interesting one, and it's an amazing course of study as regards the challenges we social workers are faced in Nigeria currently. And I must say a big kudos to our organizers and as well the Lagos State chapter, NASoW chapter. It's indeed an impressive one. I know what it takes because I myself have been trying to host up a national conference for the student angle. And I know the kind of pressure I have been faced with of Charlie of recent. So I would want to say that I am quite honored. I wish the entire and the Lagos State chapter, to be precise. I must say this is a new startup. It's quite challenging, but we can't make heads if we haven't made no effort. So this is a very good start, and hopefully the next one the next program will be organized and will be much more interesting and much more fascinating. I must say thank you all for taking part in this program today. And I wish tomorrow will be much more encouraging and much more easier to assess for us all. With that few notes of mine, I would want to say thank you to everybody once more and as well call it a day for myself. So please, our national you can speed up the event so to call things off, whichever way. Thank you so much. Thank you so much. Thank you so much.
So Dr. Plank will be on very shortly. So she is trying to come on. She will be on very shortly. Please bear with us.
Thank you for that wonderful speech, Mr. Johnson. And we are glad to have you. God bless you. And we also pray you have a successful deliberation as the student chapter starts their own conference also. So can we go back to Dr. Plan? Is she in?
She will be on very shortly. Very shortly. I'm working with her right now.
Hello,
Yes, sir.
Hello.
Mr. Law, can you hear me?
I can hear you, sir.
I'm thinking while we are waiting Dr. Plank to come on board, why not let one of the organizers have a recap of what we have done, and as we also prepare our questions, so that we will
Okay.
not keep waiting. Just a recap of what you have done so far today, for the sake of those who are joining. Thank you so
Okay.
much. God
Thank you,
bless you,
sir.
sir. Okay.
So
It could
for
also
the
be
benefit,
shared the screen. Yes,
yeah, okay.
the screen
For the
from where she
benefit,
started while we wait.
okay. So thank you everyone. So we are sorry for the technical glitches that is currently going on. So far, we are at the Nigerian Association of Social Workers National Conference, where we are having the
Hello.
conversation concerning the critical challenges that is currently happening in Nigeria and the involvement of social workers in terms of intervention of social workers in dealing with it in Nigeria. So our current speaker is Dr. Plank, a doctor of social work from University of Jos, Plateau State. So she's the one dealing with the issue of the aged. As we know, COVID-19 is the major victims of COVID-19 in terms of fatalities are aged in our society. In terms of fatalities of COVID-19 in this society so far. So that's why we have Dr. Plank to help us look at the issues critically and know how social workers can intervene in such situations. So that's what she has been discussing with us. But unfortunately, we have issues with the network from our own side. But notwithstanding, as much as possible, we would love our participants to give us their question at the question and answers section. Then for those who are on YouTube, they can put on their questions at the chat box. Definitely everything is going to be get to Dr. Plan where she's going to have give some answer. And if possible, also part of our participants on Zoom, we are going to give like 4 or 5 people an opportunity to talk to us if they have any contribution to give. But it's best for us to give it our question at the question and answer box. Then also the national president of the National Association of Nigeria Association of Social Workers has also discussed with us. He has given his opening speech, which we have all listened to. He talked about the importance, the achievement of his administration so far, which are 3 key things they are ready to do when they came in. Which one is about the national bill. 2 is to have a separate ministry for social workers, which is currently with the Ministry of Humanitarian Affairs and Social Development. So the bill, like, as he said, was debated in February 2020 at the National Assembly. So we are working very hard on it so that it will get passed, so that as social workers, we can really truly call ourselves a professional association, professionals with a council, a regulations that will weed off all issues of quacks that are practicing as social workers in our society today. So definitely we are still waiting for Dr. Clark to come on so that we can continue with our uh, with our presentation. Also, the president of the International Federation of Social Workers African region also spoke with us. Very importantly, he talked about the global agenda of social workers and how Nigeria is very important in Africa in terms of social work practice, and how it is important for us to get our practice in line as professionals working in Nigeria. So those are the basic recaps of what we've asked so far. Then the introduction was given by the chairperson of Lagos State Nigeria Association of Social Workers, where she welcomed everybody to this platform, and she wished us good deliberation so far. I think for the meantime, if possible, while waiting for Dr. Plank, some people are raising up their hands on the chat box, so that we should give them, at least I have 3 people here raising up their hands. One of them is the national president of the Medical Nigeria, AMSON, Association of Medical Social Workers of Nigeria, and is also I think he's the assistant vice president. So I'll give Alhaji Abubakar Alhassan Bichi
Is
an
the
opportunity.
deputy national president.
Yes, he's also the deputy national president of NASoW. So I'll give him an opportunity to speak with us. So you are on, sir. You can unmute yourself, sir. Alhaji.
Good evening. Good evening to all.
Continue, sir. We can hear you. If you can speak louder, please.
Well, allow me to stand on the existing protocol. I would want to suggest that I don't know, maybe you slated only a speaker will perform, will make a presentation per day, right, Mr.
Yes.
Ogedembe?
Yep.
Is that correct?
No, 2 speakers are coming on tomorrow. Today is 1 speaker. Then on the last day.
Okay, today, okay. Yes. Today is only 1 speaker. So then we have to wait for her to get.
Yes, we have to wait for her. Yeah.
We have to wait. I thought it's 2. There are 2 speakers.
No, we have to, because of the
next speaker continue. No, it's okay. It's okay.
Yes,
we have to wait for her. It's okay.
Okay.
It's okay.
Thank you so much, sir.
Thank you.
Then we have another person, Mr. Thank God Ubani. I don't know if we can allow him to speak. He has been raising up his hands and we can have him on. You are on, sir. You can unmute yourself, sir. Mr. Thank God Ubani.
Hello? Okay. Good evening, all.
Good evening, sir. Good evening, sir.
Okay, my question is, it's actually a question, and it's directed to the national president.
Okay.
I don't know if it's online to respond to the question.
Okay. So I will advise you to please type your question on the question and answer box. We are going to answer. So thank you so much. Dr. Plank is now online, I believe. So I think we can allow her to go on with her presentation. You can unmute yourself and
Can you
speak.
hear me?
Yes, we can hear you, ma. We can hear you.
Yes. So
Let me
you
share your
can hear
screen.
me?
Yes, I can hear you. We can hear you.
Okay.
You can go on now, ma. I think can you see your screen?
Yes, I can see you.
Okay. You can see your screen too. The screen.
Hello?
Yes, I can hear you. I
Yes, I
can hear
can
you.
see the screen. I can see my slides.
Okay, now you
Okay.
can continue, ma. Yeah. We can hear you loud and clear now.
Okay. All right. I'm so sorry about this.
Yeah.
Um, so I was trying to talk about the effects that the COVID-19 has had on the aged. And I said that the pandemic has caused economic hardship on caregivers of the aged, as the global economic depression led to mass layoffs, including cut in paychecks and unemployment, creating difficulty in quality of care for the aged. It has also led to it has created inability of these aged people to access healthcare. And then in developing nations like Nigeria, where we have insufficient geriatric healthcare institutions and community-based care, if we had such things, it would have made care for the aged over the COVID a bit much more better. Take, for example, in Plateau State here where I am only aware of one adult care center. Now, restrictions on movement due to social distancing and isolation is an issue. It's had its own effect on the aged too, because it has led to lack of social interaction that the aged are already used to. And honestly, this can result to other psychological issues like depression. Social distancing and mandatory self-isolation have resulted also in negative trade-offs affecting the livelihood of older adults. This has been exacerbated in the light of emerging reports attesting to the inadequacy of palliative measures. They are not so involved in these palliatives that is being given for all citizens. Can I go to the next slide, please? Next slide, please. Thank you. And another effect that this COVID has had on the elderly is this. Traditionally, families have been the bedrock of caregiving to adult care. But you know that globalization has collapsed this African age-long kinship system. And this on its own has only ended up in elevating the vulnerability of this group, especially within this pandemic era that we're in also. And then this non-availability of a vaccine for the COVID-19 gives room for perpetual fear of virus contact and death. The alarming rate of death amongst their age group is enough to initiate psychological trauma. Let's go to the next slide, please. Slide 7, please. Now, this is the crux of my paper. We want to see how social workers are expected to care for the aged during pandemics. Now, having understood the vulnerable state of the aged, care of this age category during pandemics is quite important and a very sensitive thing because it can't be handled like the way we handle other younger populations. Now, during pandemics, like the coronavirus affecting most countries today, the challenge of the situation has affected categories of populations differently. So, Social workers have an integral role in responding to COVID-19 through direct support and service to these new demands and expectations. Individuals, families, communities attend care of the aged informally. This we have known has been the traditional thing. However, there are constraints, more so that oftentimes some of these caregivers and family members are the problems that the aged themselves face. Many aged are confronted with neglect and abuse by family members and hired givers. Ofila says it in his write-up. The need for neutral persons to provide the needed care becomes therefore a paramount. Hence, a professional set of workers saddled with effective care for the elderly are the social workers. Social workers become the link for enhancing appropriate care needed for the aged. Social workers have the training and requisite skills endowed for attending to all age categories of people in the society, including children, people with disability, and people with addictions. You and I know that social workers are the group of people that help all and sundry in the society. The next slide, please. During pandemics, no, please, you've gone a bit fast. During pandemics, yes, slide 7, please. Slide 7, please. Having understood the vulnerable state of the aged, care of this age category during pandemics is very important. As I said, now, can I go to slide 8, please? During pandemics, social workers are expected to function optimally in caregiving. But firstly, they must take care of themselves and adhere to all expected protocol on prevention and care before attempting to help others. If social workers do not discipline themselves and adhere to what we have been advised to do in terms of handling this disease, this scorching thing, there's no way they can reach out to help the aged. Research has revealed that among populations, the most liable to COVID-19 infection is the aged, who often have low immunity and underlying illness conditions, making them more susceptible to infection of the virus. In my earlier introduction, when I was talking about the aged, I had told you that in secondary aging, part of the problems that they have is diseases. And so most of the aged already have underlying issues. The second thing that social workers must do is that they must avail themselves for help during pandemics. Many people have attested to the fact that when the pandemic came on, a lot of medical staff were asked to come and join so that there will be a way towards handling the pandemic. Many medical personnel would not give themselves, did not avail themselves to take care of patients because of fear, stigma. But social workers cannot afford to do this. Social workers must have a mind, a genuine empathy, and this will propel them into wanting to avail themselves. Also, as we all know, social workers function as advisors, they are educators, and they are enlightenment agents to the society during pandemics, especially to the aged group. When there is lack of information or the information is distorted, it heightens a lot of panic in crisis situations. And this can be quite traumatizing for anybody. And this can lead also to other illness conditions for the aged if not handled properly, particularly depression, high blood pressure. Now, through education, social workers can inform the public and policymakers about the plight of the aged. Since there is discrimination in distribution of palliatives and deprivation in access to medical care. Through counseling, social workers can consolidate the resilience displayed so far and urge policymakers to set up action for service delivery. Hello? Can you hear me? Hello?
We can hear you loud and clear, man. Go on, man. Go on, man. We can hear you loud and clear.
All right. Okay. So this is very important. Now, social workers have a vital obligation of ensuring policies on effects, management, and curtail on the pandemic are holistic. Social workers must have the mind and the attitude towards ensuring that everything is put in place. Where is it that the loophole lies? Where is it that government is not thinking about when it comes to the aged in this critical period? Social workers have that obligation to attend to it. They are the professionals who stand in for the voiceless and opine on issues affecting others who really have no strong grip on decision making like in traditional times. If government sets out issues or rather ways of curtailing or helping people in terms of palliatives, in terms of other welfare services towards COVID, it is the social workers that have the obligation of ensuring, of identifying to see if the aged have been included in this distribution. Because we all know that there are a set of people that cannot talk for themselves. They can't be out there to struggle. If there are no people who will represent them and talk to them, it is such that they will be totally neglected when it comes to such things. Social workers, therefore, have the responsibility of actually representing them. Social workers, I said, have also an obligation of interceding and making demands over these needs and services for the aged. The aged have nobody but social workers to rely on. And this is very important because social workers can actually make themselves to be part of policy. They know the way to go about it. Aside from being part of policy, they also know that they have the right to also help in propagating towards implementation of these policies that are made towards the care of the elderly. And all implementation on all levels will help because it will therefore drastically reduce the gap of neglect and with all other needs that the elderly will have. If they don't do this, the needs of the elderly will definitely only increase. Social workers also can use the mass media to empower the aged by striving to understand cultural diversity, appreciate cultural knowledge, and be sensitive to alternative models whose focal point is built around restoration through STEMs. We can never, social workers must never undermine the role of the social media. Take, for example, what is going on right now. It is through the social media we've all been able to gather right now to discuss about practical ways on which we can improve on the care of the elderly during this pandemic. It is also through the mass media that the social workers can voice out the needs and the neglects of the elderly. What are the particular things affecting them during this pandemic? How this can be curtailed, how it can be helped, whether at the individual level, at the group level, or at the community level. It is social workers that can actually use the machinery of the mass media to also do this. It is in the mass media that we must remember that we also read a lot about the pandemic. We see the level of people who have contracted the disease. We see the level of the number of deaths day in, day out. And it gives us an idea of what to then do about it. Sometimes not all the aged have access to this. In fact, even in undeveloped nations like our own, we know that access to some of these social devices might not be available to some of these elderly people. So we must find other measures or ways in order to inform them so that they can then also help themselves. Next slide, please. Next slide, please.
It's on, ma. Just hold on. It will get to your side.
Okay.
It's on.
Pandemics, can I go on?
You can go on, ma. Yes.
Can I proceed? Okay. I have few recommendations here to make. Since we all know pandemics are disasters that are inevitable with human existence, there's nothing we can do about that because it's a natural cause. But we must acknowledge that the adverse and drastic effects that it all populations can actually be reduced and curtailed. Managing pandemics needs to be truly holistic, using professional knowledge of all stakeholders, whether it is the medical doctors, whether it's the psychiatric, medical social workers. We must use every method and all professionals on board to actually try to. Now, social workers must ensure that in all that is being done in trying to manage this pandemic, especially in regards to the aged, they must not be seen missing in the selection and also availability or use as key actors. Social workers must therefore rise to the task of propagating social work practice and its unique services to humanity. In earlier on, in some minutes ago, when the representative of the social work boss at the African level was talking, this was what he said, that social workers must rise up to their duties. Many other professions are popular due to accessibility and identified roles. But the social work profession needs to make their impact recognized. They need to make their impact felt. They need to make their impact appreciated. All this can be done only if we come out actively and do what is expected of us. Especially in Nigeria, you would all recall that even up to date, there is the act that mandates the existence of our association constitutionally is yet to be passed into law even properly. These are things that we need to really pursue because all of this will end up in helping the social work profession. Another recommendation is that identifying care of the aged generally and more specifically during pandemic is quite needful. It cannot be overemphasized. Hence, social workers must enlighten themselves and be all knowledgeable in what is needed about the disease condition that is going on as the pandemic. And the general public, they must educate and enlighten themselves and the general public towards practical strategies on management, where best practices can be adopted and made to suit locally. We are social workers in Nigeria. If we notice a strategy that is quite important and useful in some other country, we can adopt it and make it work for us locally too. We should be seen thinking and making efforts at that. So social workers should work with all social institutions towards care for the aged. The religious institutions we have in the society must be encouraged towards enlightenment and providing psychological help. Social workers need to reach out to many of these religious institutions because they are the ones that will give hope to the elderly. And so it is very important, especially where they have been restricted to going to worship centers. Take, for example, I know that during this lockdown, There are religious bodies, organizations that restricted the elderly from coming to fellowship together with them. And if they say that social distancing should be observed, they shouldn't come for fellowship, then there should be other means, other alternative measures of trying to ensure that fellowship still goes on for these aged people, even if it's in a small manner on their own. But to completely ask them not to be involved is a bit unfair to them, because they need to be encouraged and need to understand that God is still in control. Now, the elderly also rely on social connections more than most people. And therefore, more than ever before, they need a helping hand and people around them. Because with this lockdown and social distancing, vulnerable seniors could be feeling more alone than ever. Social workers, therefore, need to step in. The role of social workers in trying to care for the elderly cannot be overemphasized. We need to sit down. We need to take up practical steps where we see government is moving, where we feel we can advise government. Where do we think as individuals we can help enlighten? We can help improve the care that is given to the elderly. Many of these elderly people are in homes suffering. Some of them might even have caught up with this disease but do not know how to go about them. The sister, we have always known that we are a helping set of people. We have always been known to be people who are trained to be empathetical to others. And therefore, we need to rise up to these difficult times. We need to find avenues to talk to families. We need to find avenues to talk to groups. We need to find avenues to talk to communities so that they know that there's a special set of people who cannot talk for themselves, who do not know how to go about what is happening, so that we can reach out to them and help them. On this note, I would love to go to my conclusion. Caregiving to all humans is therefore mandatory, and effective caregiving is better handled by professionals. The role of caregiving of the aged during perilous times as COVID-19 cannot be singly handled by social workers, but they must actually be seen actively involved. It is therefore social workers that must identify and propose to government and other humanitarian bodies, because government can never do it all. They will need to be very specific on the needs of the aged population and then also advise on how to address them. Pandemics are terrifying, but with empathetical role of social workers, with great support from governments and non-governmental organizations, the drastic effects can be minimized, elongating the life expectancy rate of the aged. Social workers must be at the vanguard of promoting policy change in the context of the challenges faced by the aged, using the media, as I had already said properly. Social workers must support the aged, raise awareness about their challenges, and they must not relent in change through investment in social protection programs and alternative means of care. We have a mandate to do what is right, to add joy and peace to humanity, to add relevance to life, and and promoting the care that we give to the elderly. Thank you very much for listening. And I apologize for the poor network and how it went. Thank you very much. Thank you.
Thank you so much, Ma. We really appreciate you. Mrs. Dogbo, I think you can take over from here, Mr. Fabio.
Thank
Yeah. Okay, I don't think she's on. So thank you so much, Dr. Plank, for the wonderful presentation and a wake-up call, I believe, for social workers all over the world. especially in Nigeria,
Thank you, sir.
to look at the issues of the elderly and how we can take care of them, not only during this pandemic, but also during critical periods that we believe our elderly people are facing in Nigeria today. So we really appreciate you for the presentation, and like you said, bearing the issue of the technical glitches that we have during this presentation, I believe every one of us can testify to the fact that this is a very wonderful presentation, and we really appreciate your presentation, man. And definitely, this is a work of a scholar, which is very, very good and very commendable. Thank you so much, man. I think we are going to go into the question and answer section now,
The
where
question and answer.
yes, where our participants are going to ask some questions. So we have those who are going to be giving their question from the YouTube channel, which we are going to be asking you, man. Then those who are going to be asking us from this platform, the Zoom. So one of the people that asked questions from the Zoom platform is Mrs. Olabisi Adebawo. She said her question was that my question to Dr. Plank: if you are the Minister of Social Work in Nigeria, what are the things or policies you will put in place that will safeguard the aged in Nigeria, bearing in mind the current situation?
Hello?
Hello, ma. Can you hear me, ma? Hello,
Yes,
Dr.
I
Plank.
can hear you now.
Okay. So should I repeat the question?
Yes, I can hear you.
Should I repeat
I
the
can
question,
hear
ma?
you.
Okay, ma.
Yes,
So
please repeat the question. I didn't get it.
okay, from Mrs. Olabisi Adebawo, our question is that
Yes,
if you are the Minister of Social Work in Nigeria today, what are the things or
yes.
policies you will put in place that will safeguard the aged in Nigeria, bearing in mind
Okay,
the current situation in the country against abuse, violence, and COVID-19? That's our question.
okay, okay.
I think you can deal with that
Well,
for yeah.
if I am made a minister, okay, of social work. Hello, can
Continue,
you
ma. We
hear
can
me?
hear you. We can hear you, ma.
We can hear you,
Hello,
ma.
can you
Please
hear
continue,
me?
ma.
We can hear
We
you, ma.
can hear you,
Continue.
ma.
Okay. The first thing that would come to mind is that I would think of what are the critical things that are actually affecting the agent. And I had enumerated, and so I would set up a panel of highly committed social workers and get them to sit down. Let's brainstorm on how we can attend to some of these problems. Then, as they come up with their own observations and recommendations, personally, I would want to ensure that whatever government is giving in terms of welfare, whether you call it palliatives, whether it is grants to help them, I will want to ensure that in all of this, all committees set up, there must be a social worker who will be there to identify and ensure that these things are done properly so that there will be no loopholes. Secondly, I would want to set up a media team that will be out there talking and educating the public about the aged, about their needs, about how they should be treated. And then if it comes to the issue of elderly abuse, I would want to ask lawmakers, I will give them a proposal on mitigations that should be meted out to people who actually abuse the elderly. I would want to then also talk to this committee that I would set up to find ways and avenues where the elderly will be made to have confidence to talk and open up about the kinds of abuses they undergo, whether it is from the family, whether it is from members of the community, or from whatever angle. These kinds of things will bring us into intimate understanding of what is actually going on. It is based on some of this, then one will be able to reach out to take up the stringent measures that are needed. And some of the stringent measures will entail direct kinds of punishments, retributive punishments that will be meted out to perpetrators that are into this abuse, so that it will serve as deterrent to people, and they will see what is done to these people when such happens. You see, honestly speaking, I think that the role of the media is very, very important. We cannot be talking just to individuals. When a large mass number of population gets to know about something, it is very important. We can go on enlightenment campaigns to talk about these issues. We take, for example, do you know that sometimes the elderly even find it difficult to accept to stay in aged homes? We need to find out what are those things that are affecting them, that is making them want to run away from such things. The burden of this elderly care, it is so much on some families because of the economic situation. We must therefore find ways in which we can actually help them. There are lots of ideas that will come up. It must not necessarily be me, but I know that if I get a good crop of gerontologists to sit down, I know we'll be able to brainstorm. But if we do not do that, we might leave out so many things, because together we create a unifying force that will be full and of very great ideas that will work towards helping the elderly in the society. I hope I have made some contributions to what she might want to know. Thank you.
Thank you so much, ma. Then the another question is from
Thank you so much, Dr.
continue, Ms. Fagbaro, you can continue.
Okay, another question is from question said, as a social worker, we should rise up to take our position in a situation where parts of the community refuse to understand one's position, to care for the elders. What can a social worker do in such situation?
Okay, all right. Now, definitely, you know that we have different cultural orientations, and different communities have their values and their value system. But care of the elderly remains paramount and is universal in all communities. I would expect that in these communities, there are key people that can be identified. Even if they are not social workers, but there are key community leaders. The first thing would be to socialize them, to enlighten them on the understanding of this category of people. Above all, to even make them understand that that is the way that we shall all go. And therefore, they need to educate members of their community. In every community, if you take your time and interact very well with the community, where there is gross misunderstanding of issues, you will still be able to find some few who understand what is happening. It is a matter of identifying religious leaders, who are the leaders of this community, who are the youths in this community. Then identify certain ones, have interactions with them, and then identify those of them that have an understanding to your mission and to the goal. And when you orient them, and when you discuss, and when you enlighten them, when you educate them, you will find out that you will have a breakthrough in that community. But you cannot just come down with ideas and what you want to implement. And where there is no understanding, it is very difficult for you to make any move. And no positive move will be done. But you would have to identify those you need to work with, those who will understand you. And when you do this, it will pave way for great success. Thank you.
Thank you, ma'am. Fatima Farouk's question is: there is a very poor financial availability to cater for the aged as the economy is in recession now. Is there any means or
Mm.
solution to access more
Hello?
funds to cater for the needy at large? Because
Sorry.
hello, can you hear me, ma'am?
Can you take that question again? I'm not hearing you well.
Okay.
Yes. Uh-huh.
Fatima
Hello? Hello? Hello?
Farouk's question:
Hello?
there is a
Hello?
very poor financial ability to cater
I
for
can't
the
hear
aged
you.
as the
Yes.
economy
Okay.
is a cater.
Hello?
Mr. Agbero, hello, Mr. Agbero, you
Hello,
need to
ma'am.
speak louder. You need to speak louder. We can't
Yes.
hear you, Mr. Agbero.
I did
Yes,
not hear her question, sir.
Now speak
okay.
louder. You need to speak louder.
Okay, I said the question is: there is a very poor financial availability to cater for the aged as the
Hear her
economy
question,
is in
sir.
recession now. The question: there is a very poor financial availability to cater for
Hello?
the aged. Hello, can you hear me?
Oh, yes, I can hear you now.
Okay, the question is: there is a very poor financial availability to cater for the aged as the economy is in recession. Is there
My network is bad. Mr. Lowe, can you please take over?
any means or solution to access more funds to cater for the needs of the time? We have cases that
Hello?
Okay, let me just come in here, please. Let me come in here. Miss Agbero, don't worry.
Okay.
Let me come in here. So the question we have here is the person. My question is: there is a very poor financial availability to cater for the aged, as the economic is in recession now. Is there any means or solution to access more funds to cater for the needy at large? Because most of the time we have cases that requires financial assistance for the aged.
Yes. In fact, this is one of the very great problems I know social workers are facing in Nigeria in wanting to attend to the care of the elderly. Now, the recess of the poor economic situation we're finding ourselves in is quite unfortunate. But we must face what is happening. We should be able to have people amongst us, social workers amongst us, especially people who work at the Ministry of Women Affairs, people who are related to other NGOs, who can actually advocate for such increased budget, if I may put it that way, or who can actually help with finances. The situation is so bad that we know that everybody is scrambling to get some finances for one thing or the other. But as I had already told you, if we do not come out as social workers and speak and request for these additional funds for the elderly, wherever there are funds, let people at the helm of affairs actually help us out. You see, there is one thing for you to be socialized into identifying or making yourself a tool to be used as in accessing or wanting to help the elderly. We have people, you must agree with me, we have people who can actually help, but some of them are not empathetic enough. And so they have the fora or the means of actually trying to get some of these funds. But many a times, because that will is not there, you will find out that they're not able to do anything about it. Why is it that, for example, why can't we lobby? Why can't we meet the National Assembly? As these budgets are going on from ministry to ministry, why can't we? Is there any ministry that does not have anything to do with the aged? There's none. Because as far as I'm concerned, all ministries have pensioners, those that are even outside the civil service. So there is need. It is all about us. If we can propagate and talk about these things, I am sure that we may not get all finances that we request, but at least we might be able to get something that we might use and be manageable about it. And then there are families that actually can take care of some of these aged. They even have the finances, but sometimes they are not willing to. We need to create avenues of visitation, of trying to talk, of trying to make sure that they understand the need to actually release and improve on some of this. I hope you do know that there are families that have elderly care kept in institutions, and the need to actually improve on what they are giving for the care of these people is there, but some of them relent in doing so. They might claim it is the situation and ground, and it is true, but they must not forget that they still have an obligation towards care of these people. It is not very easy to give a straight answer as to how we can get funds, but I do know that wherever we see funds, whether with government, with non-governmental organizations, if we make attempts at lobbying, at trying to talk so that we can get it for the elderly, God knows our will and knows our purpose. We should be able to get something. Thank you.
Thank you, Ma, for the answer. So I think we can ask another question. Yeah, another question is said, Doctor, as a social worker, we should rise up to take our
Yes.
position as social worker in a situation whereby the members of the community one is refuse to understand one's position on the care of elders in the community. What can a social worker do in such situation?
I think this question is similar to the second question I had already answered. I
Yes,
had
ma'am.
told you that a key social worker, a focal social worker that understands, or let me put it probably this way, a true gerontologist would know that in every community, you need to understand that community. You need to go close to the people, interact with them, and know the nature of how they handle care within themselves, and see where are the loopholes when it comes to the care of the elderly. Why are there those loopholes? What strategy can be derived? What can be done? And I said you can do this by using the religious leaders, you can do this by using the religious leaders, you can do this by using the youths, and you can even do this by attending or discussing with the elders themselves. They will give you information. And it is based on this information you then find ways on how to go about care in such a difficult community. And I tell you that every community has its own unique way of how they address issues and how they care for the elderly. In some communities, you will still find that they still do the communal care that we used to know in traditional times, where this house will take care of these elderly people. The next one is house A, the next is family B, the next is family C. Or if there are very stringent or serious issues, there are contributions by members of family this, and that to handle such. But in some other communities, you will find that the aged are in abject poverty. There is nobody to turn to because members of the community do not even care about them. So you see, you need to identify where is it that the community is a bit enlightened about understanding that these are a vulnerable set of people who can't do much for themselves. And so they must rely on you, community members. And when you have that understanding, it is then that you begin to strategize on how to go about it.
All right. Thank you so much, man. I think the last question we can have on the Zoom platform is this: the person said, apart from the Constitution, Is there a national law to be domesticated locally guiding the care of the elderly? Also, has Nigeria been part of any international policy on the elderly?
Well, I must be honest to say that I am not aware of any law that is specifically talking about the care of the elderly in our constitution. But I do know that the constitution has laws that talks about the rights of every individual. And I do know that the rights of every individual involves the rights of the elderly also. So, but you see, this is where we, as the social workers and gerontologists, need to come out, because there need to be very, very specific laws that guide on the care of the elderly. Take, for example, countries like advanced countries like Britain. They have specific things in the laws and constitution that have to do directly with the elderly, and they abide by it. We have to, that's why I earlier on said that we need to follow best practices in other countries and then come and localize it within ourselves also. Even if we do not have laws that are very specific on the elderly, we do have the opportunity of going into such. It is a matter of being serious about it and taking it up upon ourselves. I told you that even the act of the social work itself has not yet gone into proper function in this country. But we shouldn't be discouraged. I believe that one step at a time will help us achieve our goal. Thank you.
Thank you so much, ma'am. We really appreciate your presentation and your answer section, question and answer section. And it is very important from the question and answer section that it is important for us as social workers to take up the issue of policy advocacy in terms of promoting policies that has to do with promoting policies that have to do with the care of the elderly, both with our parliamentarians, which are people in both the National Assembly and the state assemblies, and also the ministries, especially the ministers and the commissioners, in terms of policy advocacy to those places to ensure that Nigeria as a country have policies, especially the last question, that specifically deals with the care of the elderly, not only during the pandemic, but during the lifetime of the elderly. At least they should have a national policy that will guide them in terms of their. Dr. Plank was able to give us the challenges the elderly faces in terms of poverty, in terms of diseases, in terms of housing problems and all that. So as a country, yet we don't have a policy specifically designed for this set of individuals to address these challenges for them. And no matter what we think, as social workers, we are dealing with direct practice. The direct practice we are dealing with that in terms of taking care of them might not really do much if there are no policies in place that will address the holistic issues that concerns the elderly. So as much as possible, it's also a wake-up call for us as an association of social workers to take up this policy role, policy advocacy role, because as an organization we can use it as a group of social workers, as a body, as social workers to push forward these policies. I don't know if any member of the panelists on ground can have anything to say concerning this before we round up, please. Anyone, the national president, anyone? I don't know. I don't think I need to call names. You can just unmute yourself and maybe you want to make an addition or you want to ask questions, please.
Hello.
Yes, ma'am. Yes, ma'am. You can hear you.
One of the questions, Mrs. Amotoshaw sent a question. He said, can you please briefly differentiate between a social worker and a carer?
Okay. So, Dr. Plank, I think, can you hear that, ma'am?
Yes.
Okay, ma'am.
Yes, I think the question had to do with the difference between a carer and a social worker, right?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Did I hear her right? Okay.
Yes, ma'am. That's the question. That's the question, ma'am.
Okay. You see, we social workers
Yes,
are
ma'am.
specifically trained, okay,
Yeah.
towards caregiving. We undergo a systematic way of training to become caregivers. An ordinary caregiver can be anybody in the society, somebody that just probably has some sympathy towards people. Carers can be members of the family, they can be any ordinary person. But I want to tell you that social workers are trained. They have principles that have been inculcated into them. And they hinge on these principles to carry out care that is expected. Care to social workers is not just only to the elderly. There are those who give care in aspects of school social work with children. There are those that give to the aged. There are different cares that are actually carried out by social workers. But it is all premised or all dependent on the kind of professional training that they have gotten. You would recall, I was at the Abuja National Conference that we had, I think 2017 or so, where I remember that one of the positions we took then was that we have lots of social workers, in quote, existing in the country, but they do not have the requisite training that is needed. And so everybody was encouraged. We said everybody that does not have a certificate should be encouraged to go back, to go and have a proper training at whatever level, even if it is an ordinary diploma level, so that you know certain principles, you know the history and evolution of social work, so that it can equip you better, so that you can be empowered to handle situations, because you cannot give what you do not have. Anybody could be a caregiver, but when we talk of social workers, they are professional caregivers. Why do you think that in a hospital setting, somebody is sick, he is given all the medication the doctors actually have have said should be given to the person, but then you notice that the person does not get better? It is until they consult psychiatric social workers or medical social workers, and they begin to interact with such a person, and they begin to counsel such a person, before you would see that, because it is not everything that has to do with only the physical. The mindset is a very vital thing. And if you don't have people that sit and care and have time to sit, have time to visit, have time to reach out to understand other problems and how to solve them, then we will not be making headway or improving or developing our society. So, carers are actually quite different from professional social workers. Thank you.
Thank you so much, ma'am, for the answer. So, please, is there any other person that has anything to say, please? Okay, I think let's get another person to talk from the attendees. Dr. Kafayat Kendelamidi, you have the floor. If you have, I think you have been raising up your hand. You can unmute yourself, ma'am. Dr. Kafayat.
Hello, can you?
Yes, we can hear you, ma'am. Unmute yourself, ma'am.
Can you hear me now?
We can hear you loud and clear, ma'am.
Thank you very much to the organizers, to the distinguished panelists and participants. I really appreciate this. And to Dr. Plank as well. It's a very interesting presentation she has given. And just to add a little bit on, I'm not a social worker, but from my own view here in England, I think if we want to replicate the system here to our own country back home, it shouldn't be limited to policy alone, but to include accessibility to funding, financial aid and support. for social related services. By that, I mean both the children and adult care. And that's just a bit I would like to add. Thank you.
Thank you so much, man. Thank you for your contribution, man.
You are welcome.
So I think with this we are rounding up for the first day of the national conference. Then before we go, please, we are going to send out a survey for everyone to fill. The survey is basically to know our opinion concerning this first day and to feel how satisfied we are with this. Then for us to fill our names and email for the purpose of certificate, which we are going to write your name on. So the form is going to be sent out now so that people can fill the form as much as possible. So I don't know. So I'm sending the form now. So the next, Mrs. Fagbo, I think the next agenda, you can go on with the next agenda. Okay.
Thank you. Now we have our chairperson to do announcements and closing, please. Ms. Adeto, if there's any announcements. Chairperson.
Yes, thank you, Mrs. Fagbero. Yes, let me thank everyone that has been on since 6 o'clock till now. We're sorry for the small itches that we had in between. We are promising that we will have a better time out tomorrow. The conference starts 6 p.m. tomorrow evening and it runs till about 8 p.m. We promise to stay between the time frame, not to take too much of your time. But I want to assure you that at the end of the conference, we all will have something new to take home. Like today, I've learned something new about gerontology, and I'm going to research more into this. I'm also encouraging every other person to go back and see how we can also be a party to the new social work we are all looking out for in Nigeria. It is all left to me and you. The change we are looking for starts with me and it starts with you. As we go back those nights, let's sit back and look at all we have heard here today and see how we can be part and parcel of this new beginning of social work in Nigeria. Thank you once again, and I want to say God bless you all. God bless NASoW.
Thank you very much, Chairperson. Thank you, everyone. We thank you for your patience, for your understanding. We hope to have a better day tomorrow. God bless you.